First, I would like somebody to name a couple of diseases that you're familiar with.
Cancer.
Diabetes.
Okay, cancer, diabetes. So if you had one of these diseases, wouldn't you want the most up-to-date, most successful treatments available?
Absolutely.
Of course.
Okay. So nobody said drug addiction. Are you all aware that drug addiction is a disease also?
Yes.
So there are different approaches to drug addiction. There are traditional ones, which include 12-step programs, Suboxone or methadone maintenance, and then there are alternative treatments, which are what I'm going to discuss today. Drug addiction is a disease that affects millions of Americans every day. I'm going to present with you today several alternative treatments that, if implemented in traditional treatment facilities, would increase the success rates tremendously. These alternative methods work to correct the damage that has been done to the brain by drug use. Most addiction treatment programs, the traditional ones, they just focus on the psychological aspect of drug addiction, and they don't do anything to actually correct the damage that has already been done to the brain. So first, I would like to discuss the traditional treatment methods. The main one that is used in treatment facilities are 12-step programs. This would include AA, NA, Celebrate Recovery, any kind of 12-step to where you look at your past and what happened in it, and you identify your triggers, and then you work to keep from relapse based on these. Another one is methadone and Suboxone treatment or maintenance. These, in my opinion, are just substituting one drug for another. It doesn't give your brain a chance to heal, and you still have cravings. You may not have withdrawals, and you may not feel the effects of the drugs, but you do still have cravings, which means when you stop the Suboxone or the methadone and you have the cravings, you don't really have a program in place to keep from relapse. So the traditional approaches to substance abuse, they don't have the type of success rates that they should. What I want to talk about today is the missing key to the traditional treatment, which is the physiological aspect of addiction, which would actually work to correct the brain. Drug use depletes the brain of proteins that are needed to produce endorphins, dopamine, and serotonin. This is what causes cravings and essentially relapse. The first one that I would like to discuss, the first alternative treatment, is amino acids. These are usually used as a detoxification process by IV therapy to start out with, and then after the detox process is finished, then those are taken orally in order to sustain the results. Amino acid therapy has a success rate so far of 70 to 80%, which is huge compared to traditional treatment centers. The second one that I would like to discuss is neurofeedback. This is when electrodes are hooked to the brain, and it's supposed to actually retrain the brain to think differently and to not crave. One press release said that it alters the brain chemistry by manipulating brain waves with the use of established training protocols. Donna Havens and LCSW for over 20 years said that combined with traditional approaches, neurofeedback shows success rates that are doubled. And the third one that I would like to talk about is called EMDR. That stands for Eye Movement Desensitization and Reprocessing. The way this works is a device like this would be used. You would follow the lights. You follow the lights from left to right, and what that does is it actually takes the information. It takes memories that are stored in the back of your brain, brings it to the front, so that you can process those and heal those. Those are memories that may have been stored or frozen for years in the back of your brain, and you didn't even realize that they were there. But once those are brought to the front, you can deal with those, and it can help you heal, so that way you don't have to use drugs to numb the pain. These are only a few of the different approaches or alternative approaches to treatment. There are other ones that I haven't discussed today, such as auricular therapy, acupuncture, infrared saunas, and torque release. For me personally, I tried all of these almost. My first attempt on my own was methadone. It didn't work. I still had cravings. It did not heal my brain. The first treatment center that I actually went to used Suboxone, and that kept me from having withdrawals, but it did not help to heal me, to replenish those nutrients that I had lost in my brain from the drug use. And I also have tried 12-step programs, talk therapy, and it wasn't until I combined all of these together. I now use a Christian 12-step program When I came out of my treatment center, I used amino acids. I did the neurofeedback to retrain my brain, and I did the auriculotherapy also. So in conclusion, please just remember that drug addiction is a disease and it needs to be treated as one. It's not as easy as just quitting, but there are other approaches that are more successful than just the traditional ones. With God's help and the correction of the brain, recovery is possible. Drug addiction has affected everyone, whether it's yourself, your family member, a coworker, a church member. Everyone knows someone that has been affected by drug addiction. So I encourage you today, when you know someone that is looking for a new treatment for their drug addiction, please recommend these alternative approaches. The success rate is double from the traditional ones. So it's a really good way to reach your full potential so that you can have a complete recovery. Thank you.